What's going on, FutureDDS family? We'd like to take a moment to recognize our sponsors for today's video, DAT Booster. DAT Booster is a DAT prep platform which we've seen help plenty of students improve their scores and actually gain acceptance into dental school. We've done multiple giveaways in the past for this platform, and it's actually come full circle to the point where Nick has actually used the program to improve his scores, and he's actually applying for dental school right now. So I want to give him a moment to explain a little bit about his journey, his process using the program, as well as, give us a little bit more feedback about the platform himself.
Yeah, of course. So first of all, I absolutely love DAT Booster. I was studying for the DAT for over a year. So I've seen a lot of question banks, and DAT Booster by far just seemed to be the most up to date. And I'll give you guys an example. When I was taking the biology section on my real DAT, I saw 15 questions word for word from DAT Booster. And I know I wouldn't have been able to get a 30 on the bio section without them. And I ultimately got a 27 academic average. So that's been a huge help in applying to dental schools. I highly recommend them to any pre-dent considering using their program.
So another great thing about DAT Booster is the fact that they understand that you all are actual students, right? They know you have a lot to pay for, being with applications and the actual DAT exam itself. And so what they do is they give you access to their platform to take one free test just to make sure that you like it and it's a good fit for you. Here at FutureDDS, we always preach on preparation, and we believe that the DAT Booster program is great prep for your DAT exam. If you all are interested and want some more information, go ahead and click the link in our description below. Now let's get back to the video.
My name is Vynessia Brookes. I am originally from St. Louis, Missouri, and I ended up going to Missouri State University for my undergrad degree. I majored in biology, and originally I went in to major in biology and to minor in chemistry, but when I was there I decided that I had enough time in my schedule and I really thought it would be beneficial to also add another minor, so I ended up graduating with a major in biology, a minor in chemistry, and also a second minor in general business. As far as extracurriculars, I was a part of student council, I was a part of Res Life, I was a council chair member for my dorm, I did the social media chair. I also was a part of the Black Student Union, and as far as extracurriculars, I did intramurals, I played sports all through high school. I actually went to state for shot put and discus in high school, so I kept up with sports at least a little bit in college. And a fun fact about myself, I actually do still have a baby tooth. I have a baby tooth. The permanent tooth is like sideways, so it just never pushed up. So I don't know when that tooth's gonna come out, but I don't know. It'll come out one of these days and then we'll figure it out. But as far as hobbies, I like to craft, do arts and crafts. Also, I am a cat mom, so I spend a lot of time with my cat and I do things with her, have fun. I also like to just hang out with my friends, spend some time with them, especially in school. It's really difficult to find time to spend with your friends and family. So yes, that's just a little bit about me, a little bit background. Number 2, what got you interested in dentistry? So when I got interested, going back to when I was a kid, I always wanted to be a doctor or practice in some type of medicine, and as you grow up you realize there are a lot of types of doctors, but when you're a kid you're like, oh, I want to be a doctor, usually referring to like a PCP, a physician. And I thought that that might be a path for me, but it never really felt right until I got to high school, and my god sister is actually a pharmacist, and she was in pharmacy school at the time, and she actually recommended to me saying, oh, like, you might want to consider dental. I would consider dental if I didn't mind being in people's mouths, as she put it. So after she said that, it kind of just like got me thinking. I'm like, oh, I never thought about dental. I don't know, like, no one in my family was a dentist. Like, it was never really something on my mind, but she said that and it really did inspire me. So that's when I got interested, really. I would say senior year of high school is when I locked in on, I want to be a dentist. How did you approach studying for the DAT? So I did do boot camp. It is a 10-week program. It is pretty expensive, but if you are part of your pre-dental society at your university, you can typically get a 20% off discount. So definitely look into that if you want to. I do recommend boot camp. It was just a program. It had everything all in one. It was all encompassing. It was an easy interface. It was easy to navigate. They had a schedule that you could follow or modify or change, like depending on what you personally needed. I did take the 10 weeks that the schedule recommended for studying for the DAT, and my mentality, I honestly treated it like a job. At the time, I was working 2 part-time jobs already. I was a junior, well, I was between my junior and senior year of college before I took the DAT. And I was working 2 jobs, and I just really wanted to, make sure I had enough time to study and also work. One of the jobs was a waitressing job. It was just for some extra money for college. And the second job was at a hospital as like a secretary, type of situation. I was really like patient information, and I did pick up that job just so that I could get more like experience in like a hospital, like medical setting. So I was pretty busy, but I did treat boot camp and studying for the DAT like it was its own job, and I put a lot of time in every single day I woke up, except for maybe Sundays, or I don't know if I studied on the weekend, but I probably did at least a little bit. So I would say treat it like it is a job, because if you put in the work for it now, you won't have to worry about taking it again. It is an expensive test, and it is kind of like a pain to have that on your mind. Like, oh my gosh, the DAT is like a big factor of what they look at for accepting students. So if you really put in the work the first time, of course, you can take it as many times as you need to, but I would just take it seriously the first time so that it would just minimize your chances of having to take it again. I fortunately was only needing to take it one time, so I put in the work over the course of the summer, took it, and then moved on to applying. So, what do I feel like set me apart from the crowd when I was applying? I currently go to SIU, so Southern Illinois University School of Dental Medicine, and before I applied, a few years before I applied, I think I was between my freshman and sophomore year in college, and I actually attended their pre-med, pre-pharm, pre-nursing, pre-dental camp. And in that week, we just stayed on campus and did a bunch of like seminars, rotations. It was kind of just like a camp / like conference situation for high schoolers, and it got them interested in pursuing higher level degrees after they graduated college. So I did happen to do that program at the school that I'm currently attending, and I don't think that's necessarily a coincidence. I feel like they did consider that in my application, and I did feel like it did give me an advantage. So if you are looking to specifically go to a certain school, I would look into maybe some pre-dental camps or organizations or programs you can get yourself involved in, because it just really shows like initiative. Like, yes, I could apply to any school in the country, but I have invested time into your program already before I've even applied or been accepted. So I would recommend that. I do think it helped me in the long run. I also spent hundreds of hours like volunteering, specifically at a veteran hospital that they had a dental unit, and it actually happened to be the hospital that my mom was employed at. She's a nurse practitioner, so it was nice to be able to spend a lot of time. I got to know the nurses, I got to know the hygienists, the staff, the dental assistants, the doctors, the dentists, and it really felt like a place that I belonged. I put in a lot of effort. I spent a lot of my free time there. I don't remember how many hours I volunteered there, but it was over the course of 2 summers. So I think I was up to 200, 300 hours just volunteering there. And that didn't count any of my other like jobs working in like dental settings or like medical settings or other offices I shadowed or volunteered at. So yeah, it is an advantage to really spend a lot of time in one location just to show like dedication, but it also, and over the course of a long period of time. So if you do 300 hours, but you do it in the course of a few months, it might not look as good as if you do 300 hours over the course of a couple of years. It just shows more effort, more dedication, and it is nice to spread out your volunteering at different locations so that you can see maybe corporate dentistry, private practice dentistry, government orientated, like funded dentistry. It's just a different perspective, and it will ultimately help you in the long run, because you know, if you do apply and then you do get in and then you do graduate, you are going to be out in the field of work, and you want to know kind of like what you're getting yourself into, because not every dental setting is the same, and you really need to find what's best for you. So I would just put a lot of time into it. I also did try to network as much as possible. Like I said before, I do not currently have any dentists in my family, but anytime that maybe a friend, like a friend's parent, or even my own dentist, I would ask them for connections or for recommendations on who to talk to, or where I could get my foot in the door, or where I could just get my face in the room. And I feel like ultimately a lot of little things, you never know what opportunity could lead to another opportunity. So just put your best effort into it, and you'll be surprised by what you get out of it. Okay, so moving on to questions about interviewing and the day of the interview. So describe your interview day. It did take me a little bit over a month between sending in my application and receiving an interview. I'm not necessarily sure if that's a normal amount of time, if that's a quick amount of time, but I did submit my application. Some would consider late. I did not submit my application until around the middle of August, and I know that it opens up June 1st, so I would recommend submitting your application as early as possible. But yeah, I did wait until August, and I was able to get into school, and I submitted it August 15th maybe, and my interview was sent out to me September 25th, so a little bit over a month. We showed up that day, we got to know each other a little bit, we did a couple of group activities, we did a tour of the campus, we did a tour of the clinic, and the school just kind of sat us down, told us a little bit about themselves, showed us statistics on like how many people get in, what type of people get in. Those things are good to know, because specifically my school focuses on keeping residents and dentists in Southern Illinois. So they didn't even accept out-of-state applicants until about 5 years ago. Maybe 7 years ago now, because I am a D3, and it was about 5 years ago when I was interviewing. So they didn't start accepting applicants outside of the state until a few years before I started to interview. So that is a blessing, because I am not a resident of Illinois. I'm actually a resident of Missouri. So that's helpful information to know. And then after we did a couple of group activities and they gave us a tour of the grounds, we went in for individual interviews. So they sat us down. It was 10-minute sessions, and you got 3 sessions. So it was just different doctors, professors, people that they had as the interviewer. And you went in the room, they asked you a few questions, you answered. It was a 10-minute interview. You got to ask them questions, they got to ask you questions. It was more just a conversation. They really just want to get to know you, your personality, your feel, vibe for your personality, because ultimately they do want a good applicant, and they do want someone who would fit well in the school and who would work well in the community. So just be yourself. So what tips would you give for the interview process? I do have a few tips I would love to share with you guys. One is something that may make some people uncomfortable, but I think it's good to set yourself apart from all the people they see, all the people they interview, and that would be to ask them questions. Not only about just themselves, but just questions about the university, questions about the program. Show that you have done a little bit of research in the program. Maybe know like the pillars of the school. Maybe want to know like the motto, the code of ethics that the school follows, or like just make yourself familiar with the school and the environment. It just shows that you have actually taken time and interest into that university, and they do want to see someone who is committed to them just as much as they're going to commit to you, hopefully. And then also, don't be afraid to ask questions, questioning the interviewer. Like, I remember being in my interview, and a question I asked him was, okay, so I have interviewed at other schools, and they do have a pretty set in stone like diversity and inclusion like committee program. Does your school offer anything like that? And at the time, he did say that the school did not offer anything like that. But a year later, I noticed that they did like add a program initiating like diversity, equity, and inclusion in the school. So I don't know. I mean, I'd like to think that maybe my question got them, you know, some motivation to do something like that. Of course, they were probably already in the works of doing that. But honestly, your school is there to serve you just as much as you are there to serve them. So you should ask things that you want to know. I do value diversity and inclusion. I don't want to feel uncomfortable where I'm putting my time, effort, and money. So it's not a bad thing to ask, do you offer this? Like, do you offer this? Like, what sets you apart from other schools? Like, what could I expect coming to your school that I couldn't expect going to a different school? So the interview is to get to know the institution for you just as much as it is to the institution to get to know who you are. Why did you pick your school? I am gratefully just 35 minutes away from the school. It was the closest school to my home. Of course, there are not many dental schools in the country as a whole, so it was the closest school to my house. It was also the most affordable school. It was a school that I felt comfortable with. They were the first one that gave me an interview. They just made me feel like, this actually might be a good place for me, a good fit for me. I applied to 10 schools, and they were pretty spread out around the country. I applied to a couple more schools in the Midwest. I applied to some schools out in Texas. I applied to a school in Arizona. I was kind of just seeing what schools maybe I could get an interview at, and you know, I was just trying to cast a decent net to see what might land back in my favor. But applying to 10 schools or more can get very expensive. So I would definitely consider like saving some money, talking to your parents, like getting on a plan to make sure you're financially prepared to apply to school. So my school is very special in my opinion. We do have a very small class size. Currently at this very moment, I'm at the District 7 meeting for ASDA, which is basically just like the American Student Dental Association. And coming to this conference, I see that a lot of the schools in my district have 100, 115, 120, even 140 kids per class. And my school has 50 kids per class. And once we're a third year, we get 5 or 6 more international students. So that would bring our class total size up to maybe 55, 56. It's very like a small, intimate program. I also do know that a lot of other dental schools have like the specialties built into that school. They have like an ortho program, they have an endo program, they have a periodontal program. And while that is maybe a benefit in some way, if you do want to pursue a specialty, like you're already in-house, but that does take away a lot of like hands-on opportunity for like the dental students, because if we have an oral surgery program, then the dental students probably aren't going to be extracting the teeth. It's probably going to be the oral surgery residents or fellows. Same with like implants or endodontics. I know that we do not have an endodontic specialization program at our school, so we're doing root canals on anterior teeth, posterior teeth, molars, third molars. It doesn't matter. It gives us a lot of opportunity to like develop our skills, because our like patient pool and our like management, our medicine, our like treatment plans are not being divided among the different fellows or residents. It's going straight to us as dental students. So that is an amazing thing about my school. Okay, what was the transition like going from pre-dent to finally being a dental student? It was probably one of the most exciting things I got to know when I got into school. The whole process of shadowing, taking your pre-dental classes, like, you know, struggling in school, organic chemistry, biochemistry, physics, like those things are not easy. So like just trying to get like good grades in those classes are, you know, a struggle. But then, you know, you transition, you move into volunteering, you're waking up at 6 a.m. to volunteer during winter break. Like, you know, who is really thinking that's fun? But like, you know that you're putting in the work for your career and you're putting in the work for something you want to do. So, you know, it's tough, but I did it. You know, a lot of people do it. And then studying for the DAT, that is a financial, you know, burden in some way. It's not cheap to get the resources to study for that test. It's not cheap to take that test, especially if you take it more than one time. And then interviewing, like waiting for interviews to come back, traveling for interviews, missing school, possibly missing exams, missing projects, like paying to stay, paying to get there. None of these things are free. Like the clothes you need to wear, everything is so like, oh my gosh, like I'm nervous. Like, is this ever going to work out? Is this ever going to pay off? And then finally, you get the email on December 2nd. Hopefully that says you've been accepted to one or even more than one school if you're blessed. So going from a pre-dental student to a dental student, it's like you have accomplished so much. Like you've been through so much. You feel like you've gone through so much, but it's really just the beginning of the next chapter of your journey. And it is a very, 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 very big transition. Like dental school life is not the same as college life. You might have been taking even 18, 19 credits. Like that's probably a pretty big course load in undergrad, but in dental school, we're taking 30, 35, maybe more credits. You're taking 10, 12 classes, labs. You're trying to get to know new people. You're trying to get to know professors. You're trying to get to know yourself. You do not recognize yourself. Like you don't feel like the same person you were. Like, you know, you don't have Thursday night where you can go out with your friends. You have Thursday night where you have to study for your 10 exams that week. So it is a very big transition and it's rough. I was a D1 COVID baby. Like that might have made it better. It might have made it worse. I don't know. It was difficult to be home all day and to just see my cats and to just not interact with anyone. I didn't know anyone at the school. I didn't know. It was hard. It was hard to connect to people, but I really did put myself out there to try to like make those connections, even though we were in COVID. But yeah, it comes with a lot of stress. It comes with some depression. It comes with anxiety. It comes with a lot, but just try to reach out to your community, reach out to counselors, reach out to friends, reach out to family. Try to keep yourself grounded because ultimately the season of struggle will pass and you will finish your D1 year. You will finish your D2 year. You will finish your D3 year. You will finish your D4. You will take your boards. You will pass your boards. If you put in the work, you will do these things. So it is a big difference between pre-dent and dent. But if you care enough about your career, which I feel like a lot of you do, if you made it this far in the video, you will make it there and you will be so proud of yourself for doing that. Okay, so a typical day for a first year student. Like I said, I was a COVID baby. So my first year of dental school was 2020, August. So, you know, we were not in those classrooms. We were on Zoom a lot of the time. I only went into pre-clinic simulation lab once a week for my entire first year. So that's definitely not typical. Typically, a normal day for a D1 is going to be 8 a.m. You show up for class. 5 p.m. class ends. D1 year, I think I only had 2 sim labs, so it was just 3 hours for one once a week, 3 hours for another one once a week. So we really only had 6 hours out of 8 to 5s every single day. So it is a lot of didactic work. You are going to be relearning all of your biochemistry, all of your chemistry, all of your biology, all of your anatomy, all of your basically every science class you took in undergrad, you're going to be taking those again, but accelerated. 4 years of sciences are going to be done in 1 year of school, along with mixing in some of your dental classes, some of your ethics classes, some of your sim labs. So it's a heavy course load. There's no way around that. It is a job, and most people are not able to work during school. So pick the cheapest school that is offering you a position, because I don't know if your parents are helping you pay. I don't know if you're taking out loans completely, but you will thank yourself, because at the end of the day, everyone's going to have a DMD at the end of their name. Everyone's going to have a DDS at the end of their name, and your loans are forever until you pay them. So try to pick the cheapest school you can get accepted to and one that fits you well. When does your day start? It does start at 8 a.m. and my school is essentially all year round. So we start in early August, usually the first week of August, and then we have 18-week semesters. So we go 18 weeks, have a break for, of course, Thanksgiving, have a break for Christmas. We go another 18 weeks in the spring, and then over summer, I think it is maybe 8 or 10 weeks in the summer. So it's essentially all year, and you do get 2 weeks off for Christmas, 2 weeks off for summer, and a couple breaks here and there. But be prepared to be in school. You are a full-time student at this point. We took about 10 to 12 classes. It's a lot of classes. It's a lot of syllabi. It's a lot of exams. It's a lot of quizzes. You really need to be organized. You need to keep up. Hopefully your class has some type of class calendar, because it is almost impossible to keep track of everything on your own. You're going to need help. You're going to need to rely on your class, your community, the people there to support you, to like remind you, like, hey, don't forget we have a quiz tomorrow. Hey, don't forget the exam's coming up. Like, things can slip past you. Time keeps moving, and I don't want you to miss any deadlines. What do you do for fun and breaks? I would try to spend a lot of time with my friends. Honestly, when I wasn't in school, I was trying to spend time with my friends, trying to feel like myself, like trying to feel like the person I used to be before I started school. I was loving the person who I was in school, but sometimes you really just need to feel like the person you used to be. So definitely stay around people who keep you grounded, and reach out to people in your class, because truly those are the only people in the world that know exactly what you are going through. So stick by them. The most exciting thing about going to my school, so I do commute. I don't live at home, but we did have a house like closer to my school, so my commute is about 25 minutes. Most people do live very, very close to campus. A lot of people walk to school every day because they live that close, which could be recommended. There is a lot of after hours you're going to be putting in, especially your first and second year, even your third and fourth year when you have clinical lab work to do for your patients. But first and second year is going to be a lot of simulation lab. You're going to need a lot of time to like do things for the first time. Like, you've never done a crown prep, like you've never done an online prep, like you've never created appendix. Like, those things take a while to learn, and there's a lot of trial and error. So yeah, maybe stick by close if you want to, but you don't have to. I did it, and I commuted every day, so that worked for me. But I was excited to just finally be at my school. I was excited to really get this started. Like, you do 4 years of undergrad, and those fly by. Same thing with dental, they fly by. Kind of. It is a lot of work, and honestly, the first semester of my school, every single week felt like a month. Every single week felt like a month. So try to think about that. Like, time feels like it's moving so slowly until you look up and boom, you're a third year. That's awesome. But yeah, I was just excited to start my dream, because I just really wanted to be a dentist. Like, I really put in the work. I really put in the effort. It's the only job I can see myself doing. It's the only job I want to do. I have the motivation to do. And yeah, it's a very rewarding job. It's a very rewarding career. So the most exciting thing about me starting at my school was to just start making my dreams become a reality. Biggest piece of advice for pre-dents: do not compare yourself to other people. I know it's impossible. I know it's easier said than done. I know that naturally, human nature, you are going to compare yourself to other people, but just don't do it. You don't know what people are saying. Yeah, you hear everyone saying, oh, I got a 95 on this exam. Oh, I got 100% on my crown prep. Like, people are going to make you believe that they are just not struggling. They're going to make you believe that everything's going good. They're going to make you believe that they're not stressed. They're not feeling depressed. They're not feeling anxious. They're not feeling like they're lacking or they're behind or they're not good enough. People aren't going to really be that vulnerable with you. So even if you are feeling those things, I have felt all of those things all at once, one at a time. It comes, it goes. I still feel those things, but I do not compare myself to my other people at my school. I just try to focus on what I'm doing. I try to focus on knowing what I know, doing what I do well, the best I can, putting in the effort to follow the manual, follow up my teachers, making sure that when I get to the clinic, I'm able to do the procedures that I'm have been learning for the last 2 years. Like, I just want to focus on myself. Focus on yourself, put time into yourself, put energy into yourself, and do not let other people distract you. Because if you're comparing yourself to the 50, 60, 100, 150 other kids in your class, you are actually going to drive yourself insane, and that's just unnecessary. So take it from me, don't compare. Okay, you might have gotten a 7 out of 10 and someone might have gotten a 10 out of 10. It doesn't matter. You're doing good. You're still going to be a dentist. You might have failed a test. Someone else might have got 100%. You don't know. Don't compare yourself to them. You don't know what they did to get that grade. Like, focus on yourself. Just learn what you need to learn and take the skills that you need to have in order to make it far in the clinic, make it far in class, make it far in your career. Focus on staying true to yourself and don't let people get into your head. That is a really good piece of advice. Okay, so that concludes my interview. If you do have any personal questions for me, I'm always available to talk. People even that I never know, like, that just find me on Instagram, or maybe they're a friend of a friend, I don't know. They slide into my DMs, they ask me a question, I'm more than happy to answer. I will FaceTime you. I will text you back. Don't worry. Like, if you have a question and I have an answer, I will communicate that with you. So my Instagram is my first name. It's Vynessia, Vynessia. And yeah, follow me. Send me a message. If you have any questions, I will reach back. Okay. It was nice to talk to you. I hope some of these things can be helpful for you. And good luck in your journey. You will make it. Look at me. You will make it. It's going to be hard, it's going to be long, it's going to be expensive, but you will get to where you want to be as long as you put in the effort, and you'll live a great life. So good luck to everyone watching this, and I hope you find your dreams, follow your dreams, make it happen. Okay, goodbye.